this is a 46-year-old patient who had presented for a short-term follow-up of her right breast. And the significant finding that I'll eventually show you is actually in the left breast. But just as we look at these initial views, these are 2D images from her diagnostic mammogram. That little letter B in the bottom left corner is the density, the power look density assignment for this case. So that's kind of what that density assignment looks like. This case has been categorized as a scattered fibroglandular or a density B. There's nothing suspicious really that we can detect on these 2D images. So if we go to the next slide, we can see the tomosynthesis images. So the left-hand image is showing, this is a craniocaudal still view from the tomosynthesis portion, where you can see that little tiny yellow circle that I hope that projects on your screen there, is showing a ProFound AI detection for what it thinks is a suspicious finding. This is something that was not initially detected by the radiologist, and as depicted by the blue arrow there, it's really a very subtle finding. It's just kind of an isolated little asymmetry that's sitting over by itself in the medial aspect of the left breast. No suspicious calcifications, really not much architectural distortion to speak of. This is really a very, very subtle finding, especially without the detection of ProFound AI. The right-hand image here is just showing a spot compression view, again, just demonstrating really that area of asymmetry effaces on the spot compression. There's really nothing focal or suspicious where that detection had been identified. So if we go to the next slide, I like to show, this is what I sort of refer to as my trend view. These are the 2D trend views going back in time from the most recent, so the 2023, and then as we go to the right, going back in time here. And it's just kind of showing that there's really nothing, knowing in retrospect where that tiny little asymmetry is. Maybe you could hallucinate that you can see it on the 2D. This would be really, really difficult to pick up prospectively. And as you kind of look at the pattern of that breast tissue going back over time, you could argue that it really hasn't changed much. So this was a really subtle finding. And then on the next views, we're going into the MLO view. So again, just showing on the MLO view, the 2D image on the left with no suspicious focal findings. And on the 3D still image from the tomo, you can see a very, very subtle little mass that was corresponding to that craniocaudal finding. So this was a true mass. Because we could see it in both views, we went on to an ultrasound to further evaluate the lower inner quadrant of that left breast. And so what we're showing here, so not only is the mammographic finding very, very subtle, as you can see here inside that yellow circle, at the 8 o'clock position on targeted ultrasound, there was a very, very subtle, hard to see isoechoic mass that corresponded to that finding. So not only was it really subtle on the mammogram, it was equally as subtle, and you can see how this would be very, very difficult to miss even on ultrasound. So thankfully we saw it on ultrasound. The patient proceeded to have a biopsy, and you can see on the next slide, we do have nice correlation between the biopsy marking clip and that subtle detection that was detected by the ProFound AI. This is a very small invasive ductal breast cancer in a young patient. So what are the learning points from this case? I think this is a good case to see because it shows the benefit of the ProFound AI even in just scattered fibroglandular breast tissue. So we think about the masking effect in dense tissue, but this is just showing a patient that wasn't so dense and we still were able to find a very subtle developing suspicious finding. So ProFound AI certainly in this case facilitated our detection of this really small invasive breast cancer at, you could argue, at pretty much the earliest possible stage and in a young patient. It would be pretty hard to find a cancer smaller than this of those with that morphology that we're seeing in this patient.